Nurses, Advocate Maggie, let's talk about falls. If a patient falls, you gotta call the doctor. I mean, you really do. You have to call the practitioner. You have to follow the policy. If you don't know what the policy is, please look it up because that will be held against you. That is a big, huge, big, did I say that's a big deal? Right? Especially if your patient's on anticoagulation, Xarelto, Lovenox, you have to call the provider and let them know imaging is normally in their future because they can develop a bleed somewhere. And I have seen this, and nurses get reported to the board and stand in front of civil courts when they don't follow these policies. And I don't care what setting you're in. Most recently, it was a radiology center. You can't do that. You have to call the provider. You can't send them back to the facility and not have called a provider or sent them to the emergency room. If I was working at a center and the patient came and they had a fall, they would be going to the emergency room, period, the end. So remember that. Make sure that you're following exactly what the policy says. Falls are a big, huge, big deal, right? And one of the leading causes of death because you can throw a clot, all the words, right? And then just think about the population that this most affects. So please, if I don't care if you're an LPN, an RN, an NP, whatever your letters are behind your name, if a patient falls under your care, irregardless if they're on a blood thinner, you have to follow the policy. And if you don't, and it goes civil, it could go criminal and administrative. Please listen to me. Those who follow me, those who've been under investigation, you know why I'm telling you this, right? Take a hint.